Insulin resistance causes type 3 diabetes, which is dementia. Insulin resistance causes high blood pressure. So we have to have insulin sensitive cells. How do we have insulin sensitive cells? Well, first we have to have strong mitochondria. Mitochondria are the powerhouse of the cell pretty much. So when our mitochondria is weak, then our cell is damaged. And when our cell is damaged, it's not able to take in the signaling from insulin. Insulin is a hormone, and it signals our cells to take in glucose, sugar. Glucose is the most bioavailable form of energy for the body, right? So when our cells cannot take in the glucose, now the glucose is in our bloodstream. But our glucose is not good in the bloodstream because it gets sticky, it sticks to our arteries, it creates clogged arteries, right? We don't want a lot of sugar in the bloodstream. So what does the body do? It turns that sugar into triglycerides, which are fat. That's how you get fatty liver, visceral fat, subcutaneous fat, which is the fat that you can see. And then there's fat inside the cells also. The less glucose that is getting into the cells, the more triglycerides you're going to create, the more fat you're going to create, correct? So let's recap. When our mitochondria is damaged, it's not able to take in the signals from the insulin to use the glucose as energy, right? So now the glucose is getting stored as triglycerides or fat. How do we have damaged mitochondria? Well, if we eat high sugary foods, the sugar gets into the mitochondria super fast and then it just like overheats, dies in this bitch, or becomes damaged, right? So high sugary foods. Working out induces a process called mitophagy. Mitophagy is a type of autophagy. Autophagy is cellular regeneration or cellular recycling. Mitophagy specifically is the cell changing and renewing the mitochondria in it, right? So working out induces that process. When our mitochondria is damaged and we can't get any glucose in the cells, the body's like, we have so much glucose in the blood, we need to increase our insulin so the glucose can get into our cells. So to increase insulin, now there's an overabundance of insulin. When insulin levels rise, we stop the production of nitric oxide. Nitric oxide is a chemical that dilates our blood. When our blood vessels aren't dilated, they shrink. And then it's harder for everything to work. Our organs are working overtime. Everything is working overtime. So insulin-sensitive cells starts with mitochondria health. Some good supplements for our mitochondria are PQQ, urolithin A, Shilajit. We have to stop eating high glucose foods, and we have to work out on a regular basis.